glycogen storage disease type V, highlighting the enzyme deficiency, clinical presentation, second wind phenomenon, and diagnostic findings. Question 1. Clinical presentation and diagnostic clue. A 17-year-old male presents with painful muscle cramps and fatigue during physical activity. He reports dark-colored urine after exercise. Serum creatine kinase is elevated. Exercise testing reveals a flat lactate curve with normal ammonia levels. Which of the following enzyme deficiencies is most likely? A. Glycogen phosphorylase muscle form. B. Glucose 6-phosphatase. C. Acid alpha-1,4 glucosidase. D. Glycogen branching enzyme. E. Debranching enzyme. Correct answer A. Glycogen phosphorylase. Explanation. McArdle disease, type V, is due to myophosphorylase deficiency. The muscle isoform of glycogen phosphorylase leads to impaired glycogen breakdown in skeletal muscle. Symptoms include exercise-induced muscle cramps, myoglobinuria, fatigue, and the second wind phenomenon, relief as muscle switches to alternative fuels with that blood flow. Diagnostic, flat lactate curve, no glycolysis, normal ammonia levels. Why not the others? B. Von Gierke, hypoglycemia hepatomegaly. A Pompe, cardiomyopathy infancy. D. Anderson, cirrhosis hepatosplenomegaly. Corey disease, limit dextrin buildup. Question 2. Key metabolic and lab findings. Which of the following findings is most characteristic of McArdle during exercise? A. Hyperglycemia and elevated lactate. B. Severe hypoglycemia and lactic acidosis. C. Flat lactate curve and myoglobinuria after exertion. D. Increased venous lactate and hyperammonemia. E. Hypoglycemia with elevated glucagon levels. Correct answer C. Flat lactate curve and myoglobinuria after exertion. Explanation. In McArdle disease, muscle cannot perform glycogenolysis, so glycolysis is impaired. No significant rise in lactate. Myoglobin leaks into urine. Myoglobinuria, red-brown urine. Blood glucose is normal. Hepatic glucose handling is intact. Why not the others? A, B, D, E involve systemic glucose regulation or urea cycle, not specific to skeletal muscle glycolytic response. Would you like